Osteoarthritis is the most common type of arthritis. It affects actually over 28 million people in the United States. And osteoarthritis is a condition that we diagnose by using the patient's clinical features, what symptoms they're having, and then we look at other testing, especially x-rays, to help us see what the anatomy of the joint is. And osteoarthritis is a problem of the joint cartilage. It's a wearing away of the cartilage and a bony reaction that can occur in response to that. And by those features, we can identify them on x-ray. And patients with osteoarthritis will have pain with also some functional difficulties in their joints are related to the process that's occurring there. Osteoarthritis is challenging for us as rheumatologists because there's a wide spectrum of symptoms. People can have a lot of pain, people can have functional problems, people certainly frequently have a combination of both. What we want to do with the problem is first understand the nature of it. Secondly, we can use anti-inflammatory medicines to help control the irritation and the discomfort. But most importantly are to decrease strain on the joints by exercising. The muscles are the major supporting structures of the joints, and so we want to keep the muscles strong to help take the strain off of the joints. We want to figure out from a pacing point of view to accomplish what we need to accomplish in the course of our daily activities, yet at the same time not overly straining our joints. In this regard as well, weight reduction can be quite helpful. For every 1 pound of body weight, there are 4 to 8 pounds of strain placed on your knee every single step. So a little bit of weight reduction goes a long way in terms of helping the symptomatology. There are others, if the osteoarthritis cannot be resolved, surgery certainly is an option. And a joint replacement surgery can actually have a tremendous impact on someone's life. In fact, joint replacement surgery of the hip or the knee has the greatest positive impact of any elective surgery. Osteoarthritis has a variable course. It's important to remember that osteoarthritis is not a single condition. What we talked about with the cartilage changes and the bony changes is common to all of the whole spectrum of the problem. But osteoarthritis has a genetic influence. It can be influenced by injury to the joints, and there are other factors that can cause the expression of osteoarthritis. The treatment of it is certainly based upon the conditions, the situations of decreasing strain on your joints, the weight reduction, the exercising, and the pacing and activity planning. Medicines can have a role, surgery can have a role as well. The bottom line, though, is to individualize someone's therapy as most appropriately as possible so as to do what's best for the individual patient.